Hello everyone, welcome back to OncoCipher. In today's yet another very important topic, we'll be discussing about blood collection while the colors, the meaning of these colors, and the order of the blood drawn into them. Now, each of these vials have a specific colored bulb which are coated from within with an additive which has its purpose. So, the first one is a yellow colored bulb which has no gel in it. The additive used is sodium polyanethol sulfonate, which aids in bacterial recovery. So, obviously, it is used for microbiological tests and blood culture. The next one that we'll talk about is the red colored plain bulb, which has no additive in it, and it is used for serological testing of viral and bacterial antigen antibodies such as IgG, IgM, which is used to diagnose infections and the immune status of the patient. The next one is a light blue colored bulb in which the additive is an anticoagulant, sodium citrate, which prevents the chelation of calcium. Hence, it prevents the blood from clotting. It is used in coagulation studies of PT, APTT, and D dimer. The next one is a green colored bulb in which the additive is yet another anticoagulant, which is heparin, which inhibits thrombin formation, hence avoiding the clotting of the blood, which is used for plasma based tests such as liver function test, renal function test, electrolytes, flow cytometry, and cytogenetics. The next most commonly used bulb is the lavender or the purple colored bulb in which the additive is EDTA. It again prevents chelation of calcium, hence preventing clotting of the blood. It's used in hematological findings such as complete blood count, blood typing, and molecular testing. We then move on to the gray colored bulb, which the additive is sodium potassium oxalate, which is used for glucose testing such as FBSL, RBSL, postprandial glucose testing. And this contains an anti-glycolytic agent, which I've said sodium oxalate, which prevents glycolysis for 3 days, hence used in glucose testing. Now we move on to some very less commonly used bulbs, but we must know what they mean. That is pink colored bulb, which the additive is EDTA and it is used in cross matching blood banking. The black colored bulb, in which the additive is sodium citrate, is used for ESR testing. Then there is the dark blue or the royal blue colored bulb, which has EDTA as its additive and it is used for diagnosing trace elements such as zinc, lead, and in toxicology. Now, the last bulb is, as you can see, has gel in it. It can either be red colored or yellow colored, but what's important is the gel in it, and these are known as serum separator tubes. They contain a clot activator and a gel, which acts as a physical separation between cells and plasma and the serum of the blood, hence making it easier to process. It is used for biochemical tests such as RFTs or LFTs. Now, the next most important thing that we should know is the order of the blood drawn in each of these bulbs. You cannot randomly put it in any color. So, there is a specific order. The first one that should be filled is the yellow one with no gel that is used for blood cultures to avoid any contamination as we are checking for bacteria, etc. The next one should be filled is the light blue colored one for coagulation studies. Then the serum separator tubes which have gel in it, after which we fill the green colored one for RFT, LFT, which have heparin in it. Then we fill the lavender or the purple colored one for complete blood count hematological examination. We then fill the gray colored one, which is used for glucose testing. And finally, we can use the specialized tubes, which are the dark blue, black, etc. Now, this topic is important as an exam going student for your competitive exams, a pathologist, as well as a physician. And the most importantly, even general public should have knowledge of it. So y'all must know what this is. Y'all must know the order of the draw blood in it. and the colors, what additives are used in it, and what is their uses. They will be asked in your exams, and also spread this knowledge to everyone you know, whether in the medical field or otherwise. Thanks a lot.